Welcome everybody to the fourth edition of HealthTech of the Bengal in India. As panelists, we have Dr. Dipak Nandi MD from USA.
I'll come next to Dr. Dipak Nandi. Dr. Deepak, I think you have a really vantage point when it comes to newer technologies because I think sitting in New York, you've seen how the healthcare system in the US, which is also fairly splintered, but it really used technology to the hilt, where teleconsultations went up and they gradually come down. But even then, I think there's going to be a new normal in the interaction between the physician and the patient. What are some of those interesting technologies you've identified which will change the paradigm of healthcare, and how many of them are replicable in an emerging market scenario?
Hey, good afternoon. Thank you to BCCI, Dr. Ravin Chakravarti, to Anjana Goha for the invitation. So I wanted to give you some glimpses of the latest healthcare technology that we have been viewing at. For the last 10 years, we have been providing telemedicine consults, that is video consults, to over 800 rural nursing homes in the United States. And these are very rural nursing homes using the Wi-Fi technology we have been providing, and this pandemic really brought telemedicine out in the front and the center. But I was very impressed with Dr. Suman Chakrabarti's thing of how to bring technology to the poorest of the poor people in the rural with one drop of blood, recognizing that there is a lot of other challenges like weather, challenges like logistics, transportation. So let me give you some glimpses of the latest technology. Here we have in the making of a healthcare app, whereby using any smartphone, one would be able to use the camera of the smartphone to do a retina scan. So you do a retina scan, and this can be the art of teaching how to do a scan using the camera of a phone, of a mobile phone, an iPhone. I've used the iPhone. One would be able to use the retina scan, and that retina scan would then be analyzed in the best digital lab using IBM Watson's back technology, and biomarkers of most diseases could be identified, including most cancers, using this retina scan. One then does not have to take blood, one do not have to do any transportation, there is no issue of logistics. You just do a simple scan and run the scan against the biomarkers. With this data analysis, you can zero in most diseases, and I'm talking about most communicable diseases of the tropical countries, and including cancer. So this is one technology that is in the making. It is in the form of an app, very cheap, and yet not driven by any kind of challenges of the logistics, and be available in the remotest area, but then being detected and diagnosed in the best university labs at Stanford and at Columbia. So this is one thing that I have looked into, and it is mesmerizing. The second thing that I would talk about is from my alma mater, Dr. Dipak Chopra, my alma mater being the All India Institute of Medical Sciences. He has introduced a technology during this pandemic, what is called PV. PV is almost like Siri or Alexa. It is a virtual assistant. PV has successfully intervened and prevented suicide in the last 12 months for almost over 1,000 patients. So basically, you using a smartphone at no cost, you get to PV, PIWI, and you start communicating with PV, and PV starts providing you mental health support. And this has been a big challenge during this pandemic. We found that almost 70% of the patients who came out of the corona disease had issues, had significant mental health issues, and there was a lot of teenage suicide, young adult suicide, there was a lot of depression and anxiety. So one can go to this site, PV, one can get successful mental health interventions, continuous free psychotherapy, interventions to make sure that there is no suicide. I would recommend every audience to watch a movie called Her, Her. Her is a movie that one can watch in Prime Video, Amazon, and one can see how in that movie, Her, using virtual assistant, one can go through continuous mental health psychotherapy, and the quality is much better than most psychiatrists that they are able to provide. Because what happens is, at the back, the virtual assistant keeps learning about you and keeps using the data of other interventions of other patients, and is able to do cross interventions and come up with the best solutions, which will become effective and which becomes so therapeutic that the dropout rate decreases and you keep coming back again and again. The third thing that we will talk about is in the year 2020, the Nobel Prize for Medicine was given out for a technology called CRISPR. CRISPR was the technology that won the Nobel Prize, and this was done at Stanford by a lady called Jennifer Doudna. And CRISPR is nothing but gene editing that bacteria do so that viruses are not able to kill the bacteria. So this is something protective that bacteria implemented so that bacteria, when they are infected by viruses, CRISPR. We have seen the use of CRISPR in modern medicine, which have already started. And based on the CRISPR technology, one is able to do gene editing and thereby remove a lot of diseases which would otherwise be inherited. And in the past, you would have to do an abortion. And nobody can refute the technology of the monoclonal antibody, which is rapidly removing away many forms of cancer in the last 5 to 7 years. So these are the glimpses of technology that I have seen in the United States being used, which has been extremely effective and which is cutting edge. And yet it can be brought to the rural villages, especially things like the retina scan I talked about. Thank you very much.
No, thank you, Dr. Nandi. I think that's really very illuminating, because many of these have a lot of application in India, because I think one of the biggest thing, especially in oncology, is that detection is very poor, and we detect patients when they're probably at a stage where mortality and morbidity is sort of assured. And treatment also becomes much, much more expensive, which the country can't afford. Dr. Nandi, I'll come back, and we have someone who's asked that, there's a huge incidence of non-communicable diseases in India. So we have a twin burden in India. We haven't got rid of, the communicable diseases. We have the non-communicable, and now we have a pandemic. So what can be the role of, basically the role of digital in enhancing the care, both the care of non-communicable diseases?
Yeah, so non-communicable diseases are oncological diseases. It's like cancer. I mean, that is the bulk of the non-communicable diseases. Then you have these autoimmune disorders. Autoimmune disorders like rheumatoid arthritis, scleroderma, SLE. So you have those buckets. autoimmune disorders and oncological disorders. And I had spoken previously of using the Retina Scan app in a way to identify biomarkers, which then zeroes in to the particular diseases, and the particular relevant specialist is then thereby able to intervene after the primary screening using a video consult specific to the disease and the person. And we have also seen the role of monoclonal antibodies in autoimmune disorders and also in oncological disorders. The other big bucket of non-communicable disorders are psychiatric disorders. And in the psychiatric disorders I had spoken about, and mental health disorders like anxiety, depression, schizophrenia, bipolar disorder, I spoke about the role of PIWI, which is an app which takes you through layers of question and then zeroes in on a diagnosis and zeroes in on an intervention. And should it require the intervention of a professional psychiatrist or a professional psychologist, one is able to then successfully use telemedicine to make the appropriate intervention, whether it is in the form of continuous psychotherapy augmented by medication or non-augmented with medication. So those are the glimpses I had talked about in terms of interventions in non-communicable disorders.
Thank you. So I must thank all my panelists. This has been a really enthralling discussion. I've learned a lot. I must thank all of you for taking time out. I'm sure we can keep going on. There are many questions which have come, but I'm cognizant of time. So thank you all for being on this panel. And I must thank the audience for being such a great virtual thing. Thank you. Take care.
Thank you very much.
Thank you very much, and goodbye.
Goodbye.
Thank you.
Thank you, Dr. Mehta, Dr. Chakraborty, Dr. Tripathi, Dr. Yadav, and Dr. Nandi.